Just ahead on American Black Journal, it's time to enroll in health coverage for next year. And a group of experts is here with advice on signing up for health insurance under the Affordable Care Act. Plus, I'm going to talk with one of Detroit's leading minority entrepreneurs about owning a business and helping young people get a jump start on their careers. American Black Journal starts right now.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.
Welcome to American Black Journal. I'm Stephen Henderson. The enrollment period has opened for Americans to sign up for health insurance coverage under the Affordable Care Act. It opened just today, November 1st. President Obama signed the act into law in 2010 to make quality health care more affordable and accessible for everybody. In order to be covered for next year, you got to enroll between now and January 31st. You can get more information in the Federal Health Insurance Marketplace at www.healthcare.gov. Today, we're going to look at the impact of the Affordable Care Act and give you some vital information about the enrollment process. Joining me are three healthcare experts: Dr. Abdul El Sayed, who is the head of the health department for the city of Detroit. Bridget Hurd is with Blue Cross Blue Shield of Michigan, and Brian Peckinpah is from the Greater Detroit Area Health Council. Welcome to American Black Journal.
Thanks for having us.
You know, we were talking before the show. I said, I'm not sure most people know that they have to do this. I have not heard anyone talking about it. I don't know anyone who said to me, hey, we've got to re-sign up for health insurance. Getting the word out about this is pretty important.
Absolutely. It's been one of our primary concerns in the health department and really for the mayor as well, to make sure that folks know how it is that they need to sign up, and the fact that they need to sign up every year. It's just like as we move through our lives, we make iterations. We buy new clothes, we might get a new car, etc. It's the same way with health insurance. You have to decide what it is that you want this year. Perhaps your family's grown or changed in some way, and so every year you sign up again and make that iteration.
Yeah, Bridget, what happens if people don't sign up? What if happens if they choose not to have the insurance?
Well, with the ACA, the Affordable Care Act, it is a requirement that Americans have health insurance.
Do it. Yeah, right.
You have to do it. And so at Blue Cross Blue Shield, we also work to educate people about the importance of signing up, that they need to do it annually. We go out into the community to inform and educate. And the key is, if you don't do it, it's going to be reflected when you go back to do your tax return form. And this year for 2016 is a 2.5% penalty.
Right, there's a penalty that you end up having to pay. And is that equivalent to about what it would cost you in insurance? Or
well,
is
it's up to $695 for this year. It has changed every year since the implementation of the ACA. And so basically it's 2.5% of your annual household income, or $695, which is not the equivalent right now for 2016 of what you would pay for insurance. But as it continues to change and grow every year, it could very well be.
Yeah. Brian, I would imagine that your agency, you're helping people figure out how they can afford this insurance, number one, but also trying to get them to understand that you have to do it, not just because the law says so, but because it's a good idea to have insurance.
It's really important to have insurance, Stephen, because 80% of the cost of healthcare is from 20% of the people.
Right.
People that use the emergency department as their primary care doctor. That's a high cost of healthcare. Yeah. So we do educate people about how to register, enroll in Healthy Michigan Plan and the healthcare exchange for the federal government, but also how to keep their care.
Yeah.
So how to see the doctor for the first time. Some of these folks haven't seen the doctor at all.
Yeah.
Once they enroll.
We're still dealing with getting caught up on that after the law has taken effect. I mean, there's still people who are going to doctors for the first time as a regular sort of habit.
That's right. We actually produced a video this summer to instruct people, and it's animated, on how to see your doctor for the very first time. What 3 questions to ask. Make sure that you schedule an appointment, because once you schedule, it's easier to reschedule than to try to get a new appointment.
Yeah, yeah. Dr. Al-Sayed, you are new here to Detroit, but I just learned before the show that you are a native to this area too, so you're coming home, so welcome home.
I appreciate that. Thank
to
you.
the Detroit area. Tell me what you see when you look at Detroit and sort of health overall. This is a really challenged population. It's a really challenged city. Health is one of the ways that I think that plays out more obviously than some other ways. But I'm always curious when people come here sort of new to the area, what do you see about this place that's interesting or different or special?
Well, I have to tell you, I'm incredibly excited to be back. This is a place that's near and dear to my heart. It's a place that I grew up in and I've always loved. And you're right, it does face some challenges. Some of those challenges in particular, we have some of the highest rate of babies dying in their first year of life.
Right. Infant mortality has always been a big deal here.
It's a big deal, and there are a number of countries outside the United States where a baby has a better chance of living to the age of 1 than a baby does in Detroit, and we need to address that. Another issue is
how do we do that?
Yeah. So one of the unique aspects of the city of Detroit, first, is that there are a number of folks here who are doing really, really great work, including GDAC and the health insurers and the health systems. And so they're doing a lot of really good work. Some of what we want to do in the health department is to be able to convene and to make sure that as we convene, we're stronger together, and we can make an argument about investment in the city from actors who are really interested in really helping out. We're all stronger together, and when we can do the heavy lifting one side by side, I think we have a good chance. A lot of what we want to do, Detroit's a really big place.
Yeah.
And one of the big challenges about the size of Detroit, right? Detroit in land mass is bigger than Boston, San Francisco, and Manhattan combined. But we have fewer people than almost any of these places.
Yeah.
And at the same time, the tragic irony in the Motor City is that a lot of folks don't have access to a car, right? And so what we really want to do is be able to situate health in the neighborhoods, to think about how is it that we place our resources in the areas within which people live, work, and play, and think about the problem comprehensively, right? The best way to make sure that a baby doesn't die is to make sure that people can empower themselves to make sure that a baby that they don't necessarily want at that time in their lives isn't born in the first place. And so it's thinking comprehensively about the problem. What are the kinds of households within which babies are being born into, and how can we make those households a little bit more baby friendly? And so there are a number of things I think we can do, and our hope is that by working together with our partners, we have a good chance at really getting the best ideas to the fore, bringing in resources that haven't necessarily always been here, and being able to tackle the problem in an innovative, thoughtful way.
How much of the infant mortality problem is about prenatal intervention, and how much of it is about what happens after a child is actually born?
You bring up a good point about prenatal. We often think about prenatal being that 9 months before a baby's born.
Sure.
But prenatal is also about the 20 plus years before the young woman gets pregnant. And so it's about making sure that we have a healthy neighborhoods and healthy environment within which people are living, so they can be empowered to make good decisions. Now, to your question specifically, we know that about 2/3 of infant mortality happens within the first 28 days, and often that's attributed to what happened during the pregnancy.
Before, sure.
We do have a very robust set of prenatal programs. The WIC program in the city of Detroit is one of the best run actually in the country, and it's one of those gemstones we really hold up and say you can do public health really well here. But at the same time, there's a lot more we can do, right? When it's not just about prenatal care, it's also about the kind of food that a mother is eating, the likelihood that she's able to get good regular exercise,
sure.
The kind of family support that she has in the household. And so it really is thinking comprehensively. How is it that we can address some of the challenges of paternal absenteeism, for example?
Right.
And that problem reaches far greater than simply WIC clinics where we're telling a woman about how she can be healthier and as a pregnant
It's about
woman.
community outreach
Exactly.
and sort of building that takes, that's a long-term project and proposition.
Absolutely. Public health has this sometimes has this moniker of being the group that sort of tells you what to do, and we don't really want to do that. What we want to do is be able to weave into the fabric of our daily lives those things that you need to be able to make the best possible decision for your own health.
Yeah.
And I think in the city of Detroit, because there are so many partners, people are so focused on the problem. Detroit occupies a preeminent position in the public consciousness of America. People want to invest in that, and I think there's a way forward there.
Yeah. Bridget, when people are going to the websites and trying to choose plans, I mean, as someone who at least looked at it the first time it was available, and I didn't end up choosing one, but there was a little bit of intimidation, I would say, in terms of just even knowing the difference between the plans, what I'm looking for. You guys do some work trying to help people through that.
Yes, absolutely. I've already mentioned the fact that we go out into the community to help people. We have health plan advisors and community outreach workers who make it a point to meet one-on-one with individuals to sort of help them navigate healthcare insurance. It is complex, it's difficult, it's hard to understand, and we often joke about it. We work in the insurance industry and we don't understand everything. Also at Blue Cross, we have health plan advisors. We have over 600 health plan advisors we've hired over the last few years just to be available for people to call in and get answers to their questions. It could be the most simple questions. But the point is being available, having resources, and also throughout the community, there are different nonprofit organizations that are also providing navigators to be available and answer those questions.
Well, and that, Brian, I would imagine that's sort of where your organization steps in,
Yes.
right?
Yeah, we actually have, we're a small organization, small nonprofit, we're membership based. We only have 8 staff, but what makes us effective is our partners. So we partner with health plans, with Blue Cross and with the city of Detroit to carry out our mission.
Right.
So we're able to educate people about the clinics too. You can also have a health clinic as a primary care provider, not just a doctor at a regular medical center.
Sure, sure.
Clinics like Cabrini in Corktown.
Yeah.
So there's some options for people.
What have we seen in terms of the effect of the Affordable Care Act on Detroit since it's been implemented? I mean, I know that there are more people who are insured, but of course the long-term goal is to change health and health habits. Are we starting to see that take hold?
Brian made a fantastic point earlier. You know, healthcare coverage is not just for people who are ill. It's for people who want to stay healthy.
Supposed to stay healthy. Right?
And what we're seeing is because of some of the funding for preventive services, things that weren't always guaranteed in other health plans or that people didn't have access to because they didn't have insurance, we know that Detroiters are taking advantage of those things, and that's having a knock-on effect on their health. Unfortunately, it takes a long time to measure, and we're just early on. But it's pretty clear that as we look on the horizon, it's getting better. We also know, just in terms of the solid numbers, there's been a 25% reduction in the number of uninsured in the city of Detroit.
In the city, okay.
In the city of Detroit specifically. And we also know that while there's still more to go, that's happened through 2 different systems. It's people signing up for health insurance, and at the same time, it's the state doing the work of taking on the Medicaid expansion and making sure that those in the city who might not be able to afford health insurance have access to care when they need it through that program.
Yeah, I was going to say that's a big part of Blue Cross as well. People who can't necessarily afford the plans, you're working with them as well.
We're working with them and connecting them to the right plans that's available. So you have regular insurance products that are available in the marketplace, but then also there's been the expansion of Medicaid.
That Medicaid expansion,
and so you have your traditional Medicaid, but there's also Healthy Michigan, which is the vehicle for those people who might be in the gap, but that gap is filled because of that product. So we have to direct people to the right resources. I do want to add that the focus on prevention is so essential with the implementation of the Affordable Care Act. So what we're seeing and what we always promote is just getting people to focus on increasing their physical activity, making good nutrition choices, and going to see their doctor. Simple messages, but messages that are beginning to hit home as more people have access.
Yeah, okay. Open enrollment period is November 30 through January 31st. They can go to healthcare.gov, but is there a city website as well that helps people navigate?
We're working with a number of partners, and we recommend that we want to have one place where everybody can go. So healthcare.gov is really the place to go. And there are a number of institutions, whether it be the health insurers or groups like Enroll America, that really are offering support. So if there are ever any questions, though, if folks would like to call the health department, we can definitely point them in the right direction.
Yeah.
And so
I just got to correct myself. I said November 30th through January 31st. It's November 1st through January 31st. So today is the beginning. Yeah, go ahead.
For your coverage to be effective January 1, you need to sign up by December 15th.
Okay,
so
well, that's an important. Okay, so
Yes.
get that done by December 15th.
Yes.
Okay, thank you guys very much for being here.
Great.
Thank
Thanks
you.
for having us.
Thank you.
Coming up next, a longtime minority business owner shares his secret to success. That's next, right after this look at some important moments in Detroit's Black history.
I'm Ken Coleman with a look back at African American life in Detroit. This week in 1970, Richard Austin was elected Michigan Secretary of State. In 2003, Ella Bully Cummings was named police chief. She was the first woman to serve in that post. And in 2004, Governor Jennifer Granholm declared November the 6th Fred Hart Williams Genealogical Society Day. These are significant events this week in Detroit's Black history, taken from the book On This Day, African American Life in Detroit.
MCL Jasco is a Detroit-based minority-owned business that provides a variety of supply chain management services to customers all over the world. The company has won several awards, including Supplier of the Year for 2 years in a row. In addition to maintaining a diverse workplace, MCL Jasco is also really committed to giving young people a chance to learn the business. Joining me now is the company's president and CEO, Louis James. Welcome to American Black Journal.
Thank you.
So tell me about this business, how you started it, what it does, supply chain, obviously that has a lot to do with automotive. You are one of the biggest automotive suppliers in this area, correct?
Well, we're one of them.
One of them, yeah, right?
But we started a long, long time ago in business with the family. I started in automotive about 30 years ago.
Okay.
Manufacturing. My brother owned a trucking company that transitioned into a logistics company, and we kind of diversified from area to area that allowed us to continue to grow and give opportunities for jobs for youth as well as adults.
And talk to me about the drive, your drive to do it yourself, not to work for somebody else, but to own your own business.
Well, you know, a foundation is very, very important. I was lucky to have a father who made sure we got up and went to work, and a mother who made sure we were educated. And
that's a good pair, right? That's a good
pair.
team.
And he was an entrepreneur, so it kind of gave me that ambition to always want to be that. So you kind of prepare yourself from college, and where I got into business administration. And of course, after college, you got to get a job. So I was able to work long enough to start my own business. So
and talk about that transition though, from going to work and having a job to deciding, okay, I've got enough experience, I've got enough capital and resources to be able to do this on my own.
Well, yeah, the key to getting a job is you will always focus on going into business.
Yes.
So you went to work to try to save some money. In my case, I couldn't save enough, so I was lucky that my family kind of financed my first business.
Okay.
$3,000, but my uncle had to put up his car.
Wow. So and that's how it started.
And that's how it started.
Yeah.
And at that particular time, it wasn't automotive or fast food, it was business. So whatever opportunity you could find, that was your start.
Yeah. As an African American, though, I would imagine you faced quite a number of people who said, you can't do that, or we don't want you to do that, or we're not going to let you do that.
I faced that yesterday.
Yeah, I was gonna say, right?
That's one of the issues. It never
Still,
stops.
right? You don't ever get over it.
It never get over. It just go from place to place and from profession to profession as you diversify into areas. That's
So, but how do you sort of stare that down, right? Somebody who wants to stand in your way.
Well, you just have to stare it down. You stay focused. You stay prepared, and you make sure that you have good people around you who are capable, competent, and qualified. And you just keep moving forward.
Yeah. When you started with your business, what was the reaction of the companies you supply? I mean, GM, I think, is one of your big clients. Were they helpful, or were they sort of skeptical?
Well, both.
Yeah.
It's kind of strange, I mean, there's a commitment to do something. But to what degree is that commitment? Diversity usually have a ceiling.
Yeah.
So it's kind of like you're moving just like all your competitors, but because you are supposedly a minority or a diverse company, the question is, can you do it? not because you're not qualified, but because you are minority or diverse.
Right. Sure, sure. And you've got to sort of prove over and over again.
Over and
like
over, it's a human obstacle.
Yeah.
It's not a capability obstacle.
Yeah. What impact do you think minority businesses, minority-owned businesses, have on our community? I mean, is that one of the things that's helping us move ahead?
It has a tremendous impact because usually in our community, in a lot of areas, that's the only business that our community sees. And in a minority business, it's usually small enough for you to see the total business, where if you're in a very big business, you see a layer.
Right.
So it allows entrepreneurs a chance to come work for me and meet the CFO and meet the head of engineering and meet all of the people from the bottom to the top, where if you're doing maybe an intern in a very large company, you get to that one floor and that's what you see.
And that's the limit of your exposure.
Exactly.
Let's talk about the work that you do with young people. It really is different and it's expansive. It's not just about internships. You have other kinds of opportunities that you're giving these.
It's about
young
jobs.
people, right?
But we're saying that an internship should lead to something, an experience should lead to something. So we are a very diverse company. So we're in logistics, we're in energy efficiency. So we allow our people that we train and intern to go into an experience, to go into a job, especially in non-traditional areas. The energy efficiency side was very non-traditional. And when the automotive industry had a downturn, a lot of those people were left out there. And we were able to bring in a lot of young and old people from 18 to 65 into the energy side, and we kind of changed them from blue collar to green collar.
Yeah, right. I mean, that's the emerging sector.
That's the emerging sector.
Yeah.
So being able to expose our community to that is extremely important.
Yeah, yeah. I know you participated in the Rainbow Push Global Automotive Summit. Tell me about the importance of gatherings like that, conferences like that.
It's very important, especially with Rainbow Push. We went on a trade mission to Japan. One of the problems that we had with all of the transplants, for lack of a better name,
companies from there who are locating here or opening plants here, sure.
Is we got introduced to them, but we did not get introduced to their culture. So that trip was for us to understand why does Toyota, Honda, and Nissan make the decisions that they make.
Why they operate the way they do.
Exactly. How do we get exposed to that culture so we'll better understand what they expect from us as a business, not as a minority or a diverse business?
Yeah, yeah. Have you found additional or different barriers to doing business with companies that are not American? I mean, the Japanese companies, the German companies, who also build cars in this country.
Well, the major barrier has been understanding that culture.
Yeah,
okay?
Or them understanding our culture, right? Yeah.
And that's a major one. And that's one of the things that we found. What we found is that internally, while they may have had a diversity department, their own workforce internally was not diverse.
Not diverse.
Had no commitment to what their diversity department was working towards.
Yeah.
So encouraging them to do as much inside as you are saying you're doing outside, it's the same.
Yeah. Yeah, but that's a barrier. I mean, it's
a major
it's
barrier.
One of the things.
Major barrier.
I would imagine that's a disconnect at first, at least.
It never stops.
Yeah.
Unless a commitment is made to have that workforce to understand diversity, accept it,
and value it.
And value it. Yeah. Value it. That's a very important statement. And then be committed to it. It makes it much easier then for those barriers to be broken down.
Yeah. What do you tell aspiring minority entrepreneurs about what do they have to do? What are the things that make the difference between somebody who's successful at that and somebody who tries and maybe doesn't get there?
Well, success is not promised, but you must be prepared for success, and you must strive and work every day. You must expose yourself to opportunities that allow you to be successful. You must educate yourself. You must make sure you're educated in the field that you have chosen so that you have an opportunity to win.
Yeah.
And you have to listen to advice and be able to distinguish good from bad and that's a lot of hard work.
Yeah, risk is also part of that equation too, right? The risk of giving up a good job, maybe to say I'm going to go do this on my own, and I think assessing that risk sometimes is more difficult in communities like ours, where resources are more scarce, where reliance on one person who is working might be more than in another community. I mean, making that decision as to when to do it is pretty key.
It's a major decision. Risk is the bottom line.
Yeah.
I mean, lucky for me, I came from a family that was in business, so I was able to be exposed to it. My father was a contractor, and I handled the concrete.
Yeah.
I knew I never wanted to do that again. That was too hard.
That was out.
You had to wake up too early in the morning. But it never, so I learned from that. I knew what I don't want to do. I don't know what I do want to do,
Right.
but I knew what I don't want to do.
Yeah.
So it allowed me first, though, to see his business, very small, and from the top to the bottom. And I was at the bottom in his business. So, but the risk, you have to understand those risks. Financial risk is the biggest problem.
Yes.
But how to handle financial requirements, it's the first thing that you have to learn.
Right.
It's a risk there sometimes because the financial industry or the financial companies don't think you're able to pay it back.
Yeah.
Okay?
Yeah.
So you have to be able to understand what the requirements are.
Yeah, and meet them. Yeah.
Yes.
Well, you have been very successful at that, and thank you for sharing that with our
Thank
audience
you.
today.
Thank you very much. I appreciate it.
That's our program for today. Thanks for watching. You can get more information about our guests at AmericanBlackJournal.org. And as always, you can connect with us on Facebook and on Twitter. Plus, you can hear our program on WDET 1019 FM. We will see you next time.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.